So let's start with the basics. The Affordable Care Act, or ACA, used to require everyone to have what's called minimum essential coverage, or MEC, or else you have to pay a penalty. But as of 2019, that federal mandate was dropped. That means most Americans no longer need ACA-approved coverage and won't face a penalty if they choose a health share instead of traditional insurance. So if you're wondering whether you must have an ACA compliant plan today, the short answer is no, unless you live in a state with its own individual mandate. Now, real quick, I just gotta say, I'm not a lawyer, I'm not a tax advisor or insurance broker. I'm just a health share advocate who spent years researching this stuff and helping others understand it better. So everything I share is based on public information and personal experience. So always check with a licensed professional if you have specific legal or tax questions. So as of today in 2025, the following states still have their own individual mandates that require residents to have coverage that meets their definition of MEC. So we have California, Massachusetts, New Jersey, Rhode Island, Vermont, and Washington, D.C. And here's the most important part. Now, these states generally do not consider health shares, any health shares, to meet their coverage requirements. So even if those health shares were once considered ACA compliant at the federal level. So if you live in one of those states, joining a health share on its own will not keep you compliant. You could face a state level penalty at tax time. So option one, you pair it with an ACA approved insurance plan with a health share. That way you meet your state's requirements, but still benefit from medical cost sharing when bigger medical needs arise. Your second option is you can check for state level exemptions. Now, some states allow exemptions for religious beliefs, financial hardship, or membership in certain recognized ministries. So check your state's health coverage website to see if a health share might qualify. Or you can just accept the penalty. Now, I'm not saying you should do this, but I do know people who've run the numbers and found that even after paying the penalty, they still saved thousands of dollars by joining a health share instead of using traditional health insurance. Again, I'm not saying you should do this, but for some it does work, and just make sure that you go into it fully informed. So are health shares ACA compliant? It doesn't really matter anymore at the federal level. The real question is whether your state requires ACA approved coverage, and if it does, what are you willing to do about it? Health shares are a great option for people looking to save money and take control of their health care. So if you are looking to explore more options, I put together a free health share guide just for you. It walks you through how health shares work, which ones I recommend, and what to watch out for, and how to find the right one for you and your family. Just click the link in the description below or go to my website, healthshare101.com, to download it. Thanks for watching, and I'll see you guys in the next video.